Have you ever heard of someone who was still healthy in the morning, but a few hours later fell into a coma or became paralyzed on one side due to a stroke? Stories like this are not uncommon, and what haunts us the most is often the thought, if only I had known sooner. But in reality, the human body always has a way of whispering to us before something serious happens. A stroke does not come as suddenly as we think. It often knocks first with small fleeting signs that we initially ignore, thinking it is just tiredness. We call that a mini-stroke, medically known as a transient ischemic attack. It might last only a few minutes, or sometimes a few hours, then disappear as if it never happened. But this is the clearest warning bell your brain can send. If you let it pass like a breeze, there is a high chance that a real and more dangerous stroke may strike days or weeks later. The good news is, if you can recognize these signs early, you can absolutely prevent it and take control of your health. I know, at age 50, 60, or 70, the most precious thing is not wealth, but the ability to stay alert, independent, and healthy each day. That is also why we created this channel, to share with you simple, easy to understand, but essential knowledge to live long and live well. What we bring is not random. We study hundreds of reputable medical sources, from experts in cardiology, neurology, and geriatrics, to select the most reliable information and convey it in a friendly and memorable way. Because we understand, sometimes just one complicated medical term, or a dry chart, is enough to make many people give up halfway. But through everyday conversation, with a gentle tone and respect for viewers as friends, we want to say that health is something everyone deserves to understand, regardless of age or education level. So in today's video, you do not need to take complex notes, nor memorize medical terms. All you need to do is listen, stay open, and ask yourself, has my body ever sent me signals like this? Because recognizing even just one of the 10 signs we are about to share is already a crucial step to preserving your life, your awareness, and your peace of mind in later years. Before we dive into each warning sign, the most important thing is that you understand clearly what exactly is a mini-stroke. Many people, even our loved ones, often wrongly believe that resting for a bit will fix it, or assume it is just from lack of sleep. But the truth is not so simple. A mini-stroke, also known as a transient ischemic attack, means blood flow to your brain was once blocked, even if only for a few short minutes. During that time, your brain was deprived of oxygen, and even though symptoms may disappear quickly, internal damage may already have started. You might feel slight numbness in the face, weakness in the limbs, or slur a few words, then return to normal. Because everything passes quickly, you or your loved one might underestimate it, thinking nothing serious happened, but that is extremely dangerous. According to studies from major medical centers around the world, out of every 3 people who have had a mini-stroke, at least one will experience a full stroke within 12 months. If they are not properly monitored and treated, that means a mini-stroke is like a warning bell. It does not cause major damage immediately, but if you ignore it, something more serious may come, sometimes within just days or weeks, and even worse, a real stroke can leave you bedridden, unable to speak, or in some cases, it may even be fatal. So instead of being afraid or waiting for the worst to happen, we need to take action from the very first warning signs, which are exactly what the next part of this video will share. The important thing to remember is, after age 50, our bodies are no longer as resilient as before, and each person's health condition is different. However, we can all listen to our bodies more carefully, through learning, understanding, and observation. The more accurately you understand a mini-stroke, the better your chances of avoiding its dangerous consequences. If you are watching this video, that alone is already the first step toward taking proper care of your health and your family's health. Now let us dive into the most important part of today's video. These are the earliest signs your body may be quietly sending to warn you of a possible mini-stroke. Recognizing these signs not only helps you protect yourself, but also allows you to save a loved one when needed. And the first sign you must pay close attention to is numbness or weakness on one side of the body. It could be tingling in the face, arm, or leg, and it usually appears only on one side. If this happens suddenly without injury or a clear reason, consider it a serious signal from the brain about disturbed blood circulation. Next, pay attention to your speech. If you are speaking normally and then suddenly find it hard to express yourself, start to stutter, or use incorrect words, this is not just fatigue or distraction. It could mean your brain is experiencing temporary oxygen deprivation, Also watch your vision. If you suddenly feel blurry, lose vision in one eye, or experience darkness on one side, do not assume it is just eye strain or lack of sleep. Your brain might be sending an SOS signal. To understand the importance of listening to your body, let me share the story of Mr. David. He is 63 years old and lives in Ohio. One morning while reading the newspaper, he noticed he could not see clearly on the left side of the page. He thought it was just eye strain and ignored it, but just a few weeks later, he was hospitalized due to a stroke. Doctors confirmed it was a clear early warning he had overlooked. There is more, a feeling of dizziness, loss of balance, unsteady walking, or feeling like you just stepped off a spinning ride. These are also potential warning signs, especially if the symptom is accompanied by a sudden, severe headache, the kind of pain that feels like a hammer hitting your head, not caused by stress, not from the flu, just an overwhelming pain that cannot be ignored. Another sign that is easy to dismiss but highly dangerous is difficulty swallowing or a choking sensation when eating or drinking. If you have never had this before, do not blame it on food or aging. Your nervous system controlling the swallowing reflex may be affected. Additionally, if you notice your limbs moving less smoothly, or your reaction is slower than usual, it could mean your brain is having trouble sending signals to your muscles. One more important symptom to look out for is sudden disorientation. You might forget what you are doing, get lost in your own neighborhood, or fail to recognize familiar people. Even if it lasts only a few minutes, do not ignore it. It is a clear sign that part of your short-term memory may have been disrupted. Similarly, if you feel nauseous or vomit without an obvious cause, especially when you have no digestive issues, the problem might lie in your central nervous system, not your stomach. Finally, if you feel unusually tired, weak, or uninterested in daily activities, and it is not due to hard work or lack of sleep, it may not be just aging. It could be the earliest sign from your brain that blood flow is being disrupted. A mini-stroke does not spare anyone, and it does not always come with intense pain. Sometimes, it is just a series of small signs that deserve your full attention. If you have ever experienced any of these symptoms and ignored them, it is time to change how you view your health. Your body always knows how to send alerts. The question is whether we are calm and informed enough to listen. And in the next part, I will guide you on how to respond correctly when experiencing these symptoms, and what steps you should take immediately to reduce risk. So do not leave the video just yet, because the next part will help you go from passive to proactive in protecting your brain health. Thank you for watching this far. If the information about early warning signs of mini-stroke has helped you realize something, please take a moment to act now. Click the like button below if you found this content useful. Just one simple click can help this video reach more people. Someone out there may need this information to hold on to a chance for better health they never knew they had. Also, please share this video with your parents, relatives, friends, or anyone over 50, because stroke can affect anyone, and one small share from you today could be a priceless gift for someone tomorrow. And if you truly want to join the community of people who listen to their bodies and take control of their health, leave a comment below with the words, "I am ready to take charge of my health," because, from those simple words, we are building a positive, loving, and healthier community together. One breath, one choice, one life at a time. Not everyone has the same risk of a mini-stroke. In fact, there is a specific group of people who need to be extra cautious. If you have a history of high blood pressure, diabetes, or consistently high cholesterol, you fall into a high-risk category. In addition, those who smoke, are physically inactive, or sit for long periods each day, are also increasing their chances of experiencing a transient ischemic attack without even knowing it. Especially if you have already had a mini-stroke in the past, your body is sounding an alarm that a real stroke may be closer than you think. This is not something to panic about, but rather a call to take your health more seriously. See regular blood pressure checks, blood sugar and cholesterol tests, and follow-up visits not as burdens but as chances to take control of your life. Do not wait until your body speaks through a real stroke to start worrying. Taking action today could protect you from a serious event tomorrow. If you are in a high-risk group, remember that every choice you make now can have a big impact on your future health. The most important thing you should not delay is knowing when to see a doctor. If one day you suddenly feel numb on one side of your face, have slurred speech, feel dizzy without reason, or just feel unusually weak, do not wait for it to go away on its own. Do not let overconfidence take away your chance to prevent a real stroke. Even if these symptoms pass in just a few minutes, that does not mean you are safe. Many patients ignore early warning signs thinking they are not serious and then face a full-blown stroke days or weeks later. If you can go to the hospital or ask a loved one to take you right away, do it. Do not drive yourself if you feel off balance or have blurry vision. Remember that brain-saving time is counted in minutes. Every minute you wait may be brain tissue that cannot recover. Seeing a doctor early, getting thorough checkups, and timely treatment will not only protect your brain, but also preserve your quality of life and independence. A clear decision today could be the greatest gift you give your health and your family tomorrow. Sometimes, just a moment of awareness is enough to change a life. After the age of 50, the goal is not just to live longer, but to live each remaining year in good health. To live alert, gently, and meaningfully every single day. You do not need to wait until illness comes to start taking care of yourself, because your body always has a way of whispering to you. A little unexplained fatigue, a slight dizzy spell, or a weak arm on one side. These small things could be early warning signs. And if we do not listen in time, life may leave us with two haunting words. What if I had paid attention earlier? What if I had gone to the doctor in time? What if I had taken better care of myself from the start? But you know what? The good news is, it is not too late. You can always start again, right now, today. You can choose to live differently, to listen more closely to your body, to love yourself more, to take more intentional steps to protect your health. You deserve to live in a healthy body, to enjoy each day with clarity, peace, and happiness. This journey does not need to start with anything big. It just takes one small decision to care for yourself starting today. That one small decision could be the greatest gift you give yourself. If today's video helped you better understand how to detect and prevent a mini stroke, do not hesitate to click like to support the channel and help spread this message to more people. Click subscribe today so you do not miss out on more simple but vital health tips. After age 50, if you have ever seen someone in your life experience symptoms like unusual fatigue, trouble speaking, or numbness on one side, do not forget to share this video with them. Your action today could help someone avoid a medical emergency in the future. And if you have personally gone through or witnessed these warning signs, leave a comment that says, "I've learned to recognize the signs," because every small share you make is part of building a stronger, healthier, and more proactive community. After 50, thank you for watching until the end, and see you in the next video with more helpful insights just for you.